Hello, my name's Anna Clark and I'm Head of Service for Dietetics in Community Health Services. I'm also Chair of the Trust-wide Dietetic Professional Advisory Group, which is a very important group as it feeds into a number of other meetings within the Trust. These include the AHP Exec meeting, the Nutrition Expert Forum and the Trust Physical Healthcare Group. Registered dietitians are actually the only qualified health professions that assess, diagnose and treat dietary and nutrition problems. Within Notts Healthcare, there are 21 registered dietitians and they work in various areas of the Trust. They include the community health services, adult mental health, CAMS, MESOP, intellectual disabilities, community eating disorders, both adults and children, forensic services, and there's a dietitian at general manager level within the Trust. I'm now going to hand over to a short animation produced by our professional body, the British Dietetic Association, which tells you a little bit more about what dietitians do nationally.
Finding accurate information about what you should eat and drink nowadays can be difficult, especially if you have a medical condition. There's lots of information available on the internet, social media and on TV, but not all of it is right, good or true, and not all of it is safe. So where can you go for safe, personalised advice based on the best and most up-to-date evidence? That's what dietitians do. Dietitians are regulated nutrition healthcare professionals trained to translate the complex science of nutrition into easy-to-understand advice that is tailored to you. Dietitians are the only nutrition professionals regulated by law, accountable to the Health and Care Professions Council, and required to maintain their professional competence. This means the advice you will be given will be safe, within your best interest, evidence-based, and honest. Every dietitian completes years of study, as well as clinical experience working in a range of settings to prepare to support you. So how does a dietitian make sure their advice is tailored to you? Dietitians think about so much more than just what you eat and drink. They consider all the factors that influence your diet, your relationship with food, and your wider health and well-being. Dietitians consider your age, gender, physiology, and mental health. They know one size does not fit all. If you have a medical condition, they have the skills to know how your diet will interact with your medications or treatment, and what impact diet may have on your symptoms. They look at culture, taste, and cooking skills, so they don't just recommend food that is good for you, but that you'll want to eat. They take into account your environment, social situation, and lifestyle, and your activity levels to provide holistic solutions that take account of the full picture. Dietitians are trained communicators and learn behaviour change techniques to help motivate you to improve your relationship with food. Their training means they can combine all this information with the latest scientific evidence and their own experience and expertise to create advice and treatments that work for you. You might encounter dietitians in lots of different places. They work in the NHS, in hospitals and GPs practices, as well as in the community and visiting patients in their homes. They also deliver public health services to the population at large. They also work in the private sector, helping clients to improve their diet or manage a health condition. And they work with industry and manufacturers to influence the food and drink we buy in the shops or eat in restaurants. Research dietitians ensure that we have the latest evidence on food and diet, and teach and train the next generation of dietitians, doctors, nurses, and other health professionals. They work with top sports stars to help them achieve their goals. And you'll see dietitians on TV and in the media too, helping sort the fact from the fiction and improving everyone's understanding of nutrition science. Dietitians do much more than you might realise.
We hope you enjoyed that video. So my name's Amy and I'm one of the community dietitians, and I'm going to tell you a little bit about our team. We're a small team of 9 dietitians, and also in the team there's an assistant dietetic practitioner, the all-important admin team and diabetes educators. We cover the whole of Nottinghamshire and have 2 teams, one based at Mansfield Community Hospital for Mid-Notts and one at Stapleford Care Centre for the south of the county. Being a community dietitian, it keeps us on our toes. We see people with a vast range of conditions, from providing nutrition support for adults who are underweight to helping to support parents and children with allergies. We provide a service within the neuro rehab team at Bassett Law and we have a role within Desmond delivering group education to people with type 2 diabetes. We see people in their own home, in clinic and in group sessions. And more recently, we've responded to the changing needs and developed virtual ways to support our patients through Recap Health, telephone and video clinic. We support fellow healthcare professionals offering advice, providing training, such as MUST training, and contributing to local guidelines. I'll now hand you over to Liz Archer to tell you a bit about her role.
Hi, my name's Elizabeth Archer. I'm the Dietetic Manager and Professional Lead for Mental Health and Forensics. I've the privilege today to talk about adult mental health. My colleagues in adult mental health are looking after patients whose cause of severe nutrition support need through things like food and fluid refusal. And the core business is to prevent something called refeeding syndrome. I also have had the privilege in the last 6 months to work within the MESOP and the COVID wards. We just really thank the staff there, but dietetics is critical in COVID because of sarcopenia, weight loss and the severe needs that these PERSOs and patients have. I'd now like to help and forward on to Sarah Mackenzie. Hi Sarah.
Hi, thanks Elizabeth. My name's Sarah Mackenzie. I'm the Clinical Specialist Dietitian at CAMS Inpatient Unit at Hopewood. I work with young people aged between 12 and 18 who present with a variety of mental health difficulties, including eating disorders, depression, anxiety, OCD and psychosis. We know that the majority of mental health problems can have nutritional consequences, but in addition to that, with our patient group, adolescence is a vulnerable developmental stage, and that's due to it being a period of rapid growth and development, which results in increased requirements for the majority of nutrients. The main focus of my work is working really closely with the young people and their families, as well as a really varied MDT, to ensure that young people are meeting their nutritional requirements. This might be via an individualised meal plan, oral supplements, or even nasogastric tube feeding if that's required. I'll hand over to Maria now, who'll tell you a bit about her role.
Thanks, Sarah. I'm the Clinical Lead Dietitian for Intellectual Disabilities. Our service is for the adults who have intellectual disabilities and complex physical, medical, social or psychological issues and who need specialist or intensive dietetic input. Our small team is commissioned for Nottingham City and south of the county. Some examples of the type of work we do are tube feeding, advice for people with dysphagia to enhance quality of life, advice on diet and supplements for people who are malnourished or significantly underweight. Some of these people are now healthy weight. We successfully work with people with PWS, a compulsive eating disorder, to achieve significant weight loss and enhance life expectancy. We aim to manage people in their own home or care home, but if admission to hospital is needed, we liaise with the hospital team. I'll now hand over to Holly.
Hi, thanks Maria. My name is Holly Staples and I'm the forensic dietitian based at Nottinghamshire's High Secure Inpatient Hospital. I work with both male and female patients who have been diagnosed with various mental health disorders, including psychosis and schizophrenia, as well as the National High Secure Services for females, deaf males and personality disorders. A large portion of my current caseload is geared towards developing a weight management care pathway, looking to offer patients dietary advice alongside physical activity support and psychological interventions to help reduce obesity-related comorbidities. I tend to work with patients on a one-to-one basis to support them with their nutritional needs. This could include advice for irritable bowel syndrome, oral nutrition support, or high output stoma management, which has often resulted from an episode of severe deliberate self-harm. I also work alongside the wider MDT to support patients who are refusing food and/or fluid, and we work together to review this patient's capacity to see whether they are able to make such an unwise decision or whether they can be treated without their consent under the Mental Health Act. No 2 days are the same in forensic dietetics, and this is something that I really enjoy.
Thanks everybody. We really hope you've enjoyed hearing about the role of the dietitian within the Trust.